Do you suffer with intense headaches? Have you been given a migraine diagnosis, or do you just call them migraines? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Migraines are a specific type of headache with specific diagnostic criteria. They are not the only headache that is painful, but it's common for people to have painful headaches and call them migraines when in fact they are not migraines. So today we want to talk about migraines specifically. Now, most migraines present as intense headaches that get worse over time and last at least 4 to 72 hours. So they could last, 4 hours or 3 days. Oftentimes, up to 80% of cases experience nausea, and up to 50% of cases actually vomit during their migraine. Now, migraines themselves can present differently. Some patients, up to 60% of patients with migraines, have prodromal symptoms, meaning up to a couple days before the migraine actually hits, they can have a change in quality of life, such as food cravings, mood changes, photophobia, so light affects them, or phonophobia, sound affects them. Multiple different things can be prodromal or hinting that a migraine is coming. Then once you have a migraine, you could have a migraine with aura or without aura. Up to 30% of people with migraines have an aura. So this means that there's changes in sensation, so their ability to feel on their limbs. Maybe it travels up or down a limb, arm or leg. Maybe they lose taste, or they have sight issues due to light, or sound issues. So there's an aura with it, and the visual changes could be changes in their visual field where they lose, say they have hemianopsia or lose half a field of vision, or they start to see C-shaped things in their field of vision. So an aura makes the migraine even worse and can incapacitate the person with the migraine. So what are the causes of migraine? Because many people with migraine are left with Imitrex or some sort of medication to help with the symptoms, but no actual solution for the cause, and oftentimes no one has looked for the cause. And determining the cause can be difficult because there's many potential triggers. Hormonal imbalance is one trigger, and the hormonal changes or the hormonal trigger could be occurring around ovulation, during the menstrual portion, different periods of the menstrual cycle for a female. Trauma can cause migraines. So mild traumatic brain injury or blatant traumatic brain injury, concussions, all forms of head injury could cause migraines. Lack of exercise or sedentary living could cause migraines. Stress can cause migraines. Food additives such as MSG and aspartame. So if you love your diet sodas and you have migraines, the soda could be gas on the fire there. So you want to cut out your MSGs and your aspartame sources. Also, look at your chewing gums, because chewing gums often have aspartame in them. Sensory stimuli such as bright lights, strong odors, loud sounds, those can trigger migraines. It can also be, remember, signs or prodromes of a coming migraine. Changes to your sleeping pattern. If you work third shift, or you've always had normal sleep, but life happens and now your sleep has changed, that can drive migraines. Sleep deprivation can lead to a whole host of issues for your health, not just migraines. One interesting one is barometric pressure change. So when a low pressure system moves through, when barometric pressure changes and there's less relative oxygen per breath, that is very pro-inflammatory, and that inflammation in the brain can lead to migraines. And then lastly, there's certain foods like aged cheeses, wines, and chocolate that in some people can cause migraine. And that could be due to sulfites in the wine, that could be due to dairy sensitivities, that could be due to histamines, that could be due to multiple components of the foods. So if you are someone that deals with chronic intense headaches, then you first need to determine if that headache is truly a migraine or not. And then if it is a migraine, and even if it's not, you also want to be aware and evaluate your life for potential triggers and start to notice if any specific trigger correlates with onset and timing of your migraines. Functional medicine practitioners are trained to evaluate the broad range of potential triggers in your life. And so if you have tried Imitrex and tried conventional medical care and had no real progress on your migraines, then consider a functional practitioner who will look under different stones than conventional medicine looks and will leave no stone unturned to find that cause. And once that cause is found, address that cause.